So, what if the price of life saving medicine here in the US was just suddenly slashed by over 80%? Well, that is the huge promise behind a massive new White House plan called TrumpRx. Today, we're going to break down exactly what this plan is, who's making the deals, and what it could really mean for your wallet. It's a question millions of us ask, right? Every single time we're at the pharmacy. Why are we paying so much more for the exact same drugs that people in other countries get for a fraction of the cost? It's a problem that's been around forever, and a new administration is now aiming to tackle it head on.
So what is the big idea here? What's the solution? Well, it's really a one-two punch. A brand new pricing policy combined with a new government website called TrumpRx. The core idea is to let people pay cash for certain drugs and get a massive discount, bringing our prices way closer to what the rest of the world pays.
Now, the engine that makes this whole thing run is a concept called most favored nation pricing. Honestly, the easiest way to think about it is like a national price match guarantee. The policy basically says the US will not pay more for a specific drug than the lowest price that any other developed country pays for it. It's a really simple idea, but it has potentially huge implications. And this slide really puts it side by side. On the left, you've got the current system, where prices are all over the place, negotiated one by one, which usually leads to us paying the highest prices in the world. But on the right, you see the new model. It just pegs US prices to whatever the global low is. It's a complete change in strategy. Okay, so that's the theory. But how does this policy actually translate into real-world savings for people? Well, it all comes down to making deals. And this isn't just some plan on paper. Major drug companies are already signing on the dotted line. And the first big domino to fall? It's a huge one, Pfizer. They've just announced a landmark agreement, becoming the very first company to jump on board. And the White House is promising they're just the first of many to offer these kinds of steep discounts. And here is where the rubber really meets the road. Just look at these numbers. Duvi, a drug for menopause symptoms, plummets from $233 a month down to just $30. And Xeljanz for arthritis drops from a staggering $6,000 to $3,600 for cash-paying customers through this new platform. I mean, we're talking about a saving of over 85%. It's wild! And the deal is much bigger than just a couple of drugs. As you can see here, Pfizer has agreed to offer all of its prescription drugs to Medicaid at these new low prices. And this is crucial. All of their new medications will also be sold at these prices from day one. That could affect a huge range of treatments in the future. So, what's in it for Pfizer? Why make these deep cuts? Well, in return, they've pledged a massive $70 billion investment in US manufacturing and research. From making that commitment and lowering their prices, the company gets a 3-year break from tariffs. It's a really powerful incentive to bring production back home. But Pfizer is just the beginning. The administration is already in deep talks with Eli Lilly and Novo Nordisk. You know them, they're the makers of those incredibly popular weight loss drugs, Zepbound and Wegovy. These talks could bring some of the most in-demand medications in the entire country into this TrumpRx program. And get this, reports are suggesting that the target price for some of these drugs could be around $149 a month for certain people on Medicare. For those treatments, that would be an absolute game changer. An announcement on a deal is expected any week now. Of course, anytime you have a plan this ambitious, it's going to spark a huge debate. Is this a historic breakthrough that's going to change everything? Or is the impact going to be a little more limited? So on one side of the argument, you have folks like FDA Commissioner Dr. Marty Makary. He's calling the agreement a major step. He's arguing it finally gets at the bigger issue of healthcare costs, and he's promising that Pfizer is just the first of many companies that will be making similar announcements. But on the flip side, you have some healthy skepticism. Industry expert Stacy Ducicina is pointing out that because this whole platform is for people paying with cash, it might not help folks who have insurance or those who can't even afford the discounted prices. So the number of people who really benefit could end up being smaller than what's being promoted. So, with the plan, the deals, and the debate all laid out on the table, the big question is pretty simple. What happens now? All right, let's just quickly walk through the timeline of how this is all playing out. It kicked off back in May of 2025 with that executive order. Fast forward to now, November, and we have the first monster deal with Pfizer. The White House has to expect more deals just like it in the coming weeks. And then the final piece of the puzzle, the TrumpRx.gov website where you can actually get these prices, is slated to launch sometime in 2026. And so that leaves us with the ultimate question, doesn't it? Is this the start of a genuine reshaping of the American drug market? A move that's going to bring widespread, lasting relief to millions? Or will it end up being a more limited program that helps some people out, but ultimately just scratches the surface of a much, much larger problem? That's what everybody is going to be watching.